Our first guest today is Robin Ashmore, Manager of Radiology Services at Novant Health. Well, welcome to the show today, Robin. It's such a pleasure to have you.
Thank you very much. I'm glad to be here.
Great. Well, let's start off by learning a little bit about who Robin is. Tell me a little bit about your education and your background.
Okay. I went through radiologic technology program at a large level 1 trauma hospital in Macon, Georgia, almost 20 years ago.
Wow, you don't look old enough to do that 20 years ago,
Thank
Robin.
you very much. I am board certified in radiography, CAT scan, and MRI. I have extensive experience in the hospital setting as well as the outpatient imaging setting.
Wow, that's quite impressive. You come with a wealth of knowledge.
Thank you.
Well, tell me, how long have you been at Novant Health Brunswick Medical Center?
I just moved here October of last year. I have been with Novant. I started with Novant's outpatient imaging division in Georgia. In 2011, I moved to Fayetteville with Novant, and then October of this last year, we moved here and I joined the hospital.
Wow, that's awesome. Well, how do you and your family like it here?
We absolutely love living in Brunswick County. It's a great place to live.
It is a great place to live. I would echo that. And the weather's great and the people are phenomenal. So let's talk a little bit about your role at Novant Health Brunswick Medical Center. What is it that you do?
I'm the manager of radiology services at the hospital.
And how large of a staff do you have, Robin?
We have approximately 40 employees throughout the hospital and our outpatient facility.
Well, that's a lot of people that you have to manage. That's a big job. Well, we specifically wanted to talk today about the imaging services that you provide at Brunswick Medical Center.
Yeah, the radiology department is a full-service radiology department. We offer general X-ray, fluoroscopy, mammography, ultrasound, nuclear medicine, CAT scan, and MRI.
How did you remember all that, Robin?
I've been doing this for a long time.
Well, let's talk a little bit about those services. I mean, you rattled them off, and explain to me, like, what some of those services entail. Like, if broken bones, like, what all do you?
Absolutely, we can do the imaging services for a broad spectrum of reasons. Like you said, for a traumatic injury, we can do X-rays to look at broken bones. We can do studies such as CAT scans and MRIs to follow or stage a disease such as cancer or multiple sclerosis. And we can do exams such as MRI to look at a joint for generalized pain for no trauma or anything like that to rule out arthritis or instability in that joint.
Now, you talked about CAT scan versus MRI. Tell me a little bit about the difference between the two.
The difference between the two mainly is that CAT scan is X-ray based. Most of what we do that for, we would use that for, it's very good for broken bones. It's very good for looking at abdominal work. It's very quick, so you use it in situations like for a stroke, to rule out a stroke. MRI is an imaging modality that is based off of a magnet. It uses a large magnet, and we use that to see more detail, like with joints, like in a knee. You can see the tendons and the ligaments.
I recently had knee surgery at Brunswick Medical Center, and I had an MRI there, and what a pleasant experience compared to the older versions of MRIs. It's such a large scanner. And
it is. It's what they call a wide bore MRI scanner. And it gives you so much more room than the old scanners did. The old scanners, we had a lot of people who were very claustrophobic, and now we can scan those same people because the bore is so wide on this scanner.
I am somewhat claustrophobic, but I think what helps most is that window that's behind the unit.
The natural light coming in the room really does help.
And so you don't feel so penned in, and it's so big that you don't feel like it's closing in on you, but I digress. Now, I know that we briefly touched on mammograms. Let's talk a little bit about mammograms.
Okay.
Tell me the kind of equipment that you have.
We have a digital mammography equipment. We do preventative screening mammograms, and if required, we do diagnostic mammograms. The difference is most women at the age of 40 are recommended to have a screening mammogram every year, and that's just to to make sure that there is nothing. If the radiologist feels like they may see something or there is something there, we bring them back for additional images, which is what we call a diagnostic mammogram, where they do more detailed imaging of the area of concern.
Mm-hmm. Now, I think I heard that you don't always have to have a doctor's order for a mammogram. Is that correct?
That is correct. For a screening mammogram, you do not have to have a doctor's order, and you do not have to have an appointment either. You can walk in and
no appointments necessary?
No appointment necessary for mammogram. Now, when you do walk in, there may be patients ahead of you, and you may have to wait, or you could call ahead and schedule to guarantee a time. But another good thing is that most insurance companies now cover preventative screening mammograms as long as you're 40 years old or older, you don't have any breast problems, and that it has been 366 days since you had your previous mammogram.
Yeah, I know. We always have to write that on the calendar. It's, 365 plus 1 day
Yes.
in order to get our next one. So, well, that's really good to know. How many days in advance does a patient need to schedule an appointment if they need some service?
Generally, we can schedule an exam same day or next day in all modalities. Some exams, there are exceptions. It depends on the preparation that's required for the exam and the insurance requirements on authorization for that exam. But generally, we can do either same day or next day.
Really? So if I called today, I could likely get in tomorrow?
Yes.
Okay. Well, what if I've had images done at another facility? Can I then come to Brunswick Medical Center for those?
Absolutely. Our staff will work and find out where you had your previous imaging,
Really?
and we can get those images and reports if the radiologist needs them, and we can also send the results to your primary care provider, wherever that may be. We have a lot of people who visit the area from all over, and we can take care of that. We can get the images that they had prior, and we can make sure that their primary care provider gets the results from our exams.
Yeah, especially visitors to our area. They wouldn't necessarily have their CD with them or
yes.
of
and
past.
We can work with them and make sure we get that.
That's awesome, Robin. That's great. Does Novant Health have any other facilities in the area that provides imaging services?
We do. We have a facility in the southern part of the county down at Sunset Beach. It's called Sea Trail Imaging, and we do walk-in X-rays at that facility. So people down in the southern part of the county that really don't want to or can't drive this far up, we can take them on a walk-in basis for X-rays in that facility.
Oh, well, that's great. So the folks in the Calabash, Little River, Sunset Beach area, they needn't drive all the way to the hospital.
For an
They
X-ray.
can have it
Absolutely.
there in Sunset Beach. Well, that's great. And do you happen to know the hours down there? Is it open every day?
It is open Monday through Friday. Friday is a half day. Right now we close at noon, but every other day we're open from 7:30 a.m. to 5 with a break for lunch.
That's great. 7:30, that's really good.
Yes.
You don't often find that.
Yes.
Well, what's the best way for someone to schedule an appointment? How do we make that happen, Robin?
There are multiple ways that can happen. When you're in your doctor's office, the doctor's office can actually call our scheduling department and make the appointment with you right there. Or the doctor's office can fax over the order to our scheduling department, and they will call you personally, find the best time for you to come in and set that up. And the last option is if the patient has a copy of the physician's order, they can personally call our scheduling department and set it up however they want to.
Oh, well, that's great information, Robin. It's been such a pleasure to have you here today, and we've learned so much, and I look forward to having you back when you can tell me about a new modality that's come on board.
Thank you very much for having me. I enjoyed it.
You're welcome.